Hello, and welcome to the Bike Club informational session. My name is Andrew Gillies. I am Education Coordinator for Canadian Dental Implant Training Center, under whose umbrella we have the Bike Club, which you'll learn about today, as well as Bike Club's big brother, the AAID Vancouver MaxiCourse, which is a 300-hour CE surgical program in implant dentistry. I've been in the implant CE world for the last 8 years. I also oversee BC Endo Solutions, an endodontic program, and I'm honored to introduce Dr. Paul Newitt, who is the founder and director of Bike Club. Paul is a very modest gentleman, so he's not going to talk too much about his background, but I wanted to emphasize that he's had years of experience in teaching and training fellow dentists, starting with the founding of a laser dentistry study club in Vancouver and an extensive experience in cosmetic dentistry. He's been involved in implant dentistry for many years. He took our Maxi course a number of years ago, so he has a huge amount of knowledge, and he put this program together primarily because there just were not prosthetic study clubs available in our area. Welcome, and I'm going to turn it over to Dr. Newitt.
Hey, thanks, Andrew. Yeah, I just assume the reason that I don't bring those things up is because I just assume everybody's done the same thing pretty much. So I feel like I'm talking to people that know what they're talking about most of the time. That's because I'm surrounded by some really amazing people, especially at MaxiCourse and that. I mean, everybody is so geared towards lifelong learning and just excited about getting together and sharing ideas and helping each other out. Which is, really motivational for anybody involved. I have to say, one of the things that COVID has done, in sort of a side thing, is by knocking that out, it knocks a bit of motivation out of you in terms of your enjoyment of doing things. Because when you get together with colleagues that are equally excited, and you get together in a room and you're sharing that information, it kind of spreads, kind of like the virus, right? It's just very contagious. And I do miss that. I mean, that's fun to be in that group. It's fun to be with people. And this whole online thing is a whole new way of doing it. And it's definitely got some benefits. And then my commute's a little bit easier. But yeah, I miss hanging out with people and socializing and laughing and having a good time and learning at the same time, because that's what it's got to be about, right? I mean, it's some pretty heavy, serious, dry stuff in a lot of occasions. So you got to mix it up a bit. So the online thing is all new for us, and we're adapting, as I'm sure you guys are. And this is tonight. I'm just going to give you an idea of where we're coming from and the idea behind Bike Club. The enrollment in Bike Club is when you actually get all the the nitty gritty and the pearls and all of that. But tonight I'm just going to show you kind of how this developed, so you can get in your mind, why and where it's going and what it can do for you. Hopefully it can do things for you. So share the screen here, Andrew.
Yeah, go for it.
Okay. Screen share. Okay. And I should be able to get this going. Let me know what you see.
There we go. Up and running.
Yeah, Denise, Marielle, you're good. You see the big BC there?
Yeah, looks good.
Yeah, it looks like British Columbia,
Yep.
Right? Sorry about that, Denise. We're a little bit biased here. So.
It's okay. It's beautiful. You're allowed to be.
Yeah, thanks. Yeah, so I've been actually involved. I hate to think about it sometimes, but I've been involved in implants for about 25 plus years now. When I first got out of school, I was completely lost in a lot of areas, prosthodontics, implants for sure. But I had a lot of training in surgery. I, in fact, would take in my class anybody who was sick, anybody who passed out during a surgery. I was always jumping on that and taking their surgical rounds. I did all my summer internships at the hospital with surgeons, and I just kind of loved the whole surgical side of it. But when I got out and I became an associate, the primary didn't really want me doing anything. So I was doing a lot of hygiene and, working my way up, and things got a bit rusty, certainly. But sort of kept going to courses, and um, it was a bit disappointing because one, you're a new grad, you don't have a lot of money. So the money you do spend on these courses sometimes is, a couple meals a week, or some payments on your student loan. But I found these courses, a lot of them were very frustrating, and that you'd go to these courses put on by, in my case, certain specialists, and I'd actually come out of those courses with no more information than a prescription pad and a referral pad, or referral pad on, you know, how to refer. And as Denise mentioned, you sometimes end up in these situations where you just send patients out because you don't have a clue what's going on, and then they come back and you got to deal with this. I just used to find that really frustrating. And again, you're spending money and time. You should be getting something out of it that helps you directly, not helps you learn how to send everything to somebody else. So that's part of the mentality behind where I'm coming from with education. So, but I have to say, even with all the surgical training I had, and all the confidence I had in that regard, implants still kind of scared the heck out of me. Some of the stuff that I was seeing early on, like sinus implants and all on fours, and I was going to Paulo Malo's courses back then. I just kind of blew my mind. I thought, how can you even do this? How is this medically legal? Because some of that stuff, when you first get started, is pretty scary looking. And you forget as you go along 25 years later, and Andrew's great at righting the ship for us when we start to go off in the wrong direction because we assume everybody knows what we know. You forget that 25 years ago, or at the beginning, there's still a lot to learn. And you guys definitely, Denise, Marielle, as anybody that gets involved, don't ever feel like you should not answer a question or not bring up a topic because there may be embarrassment of not knowing something. I mean, we all help each other, and I certainly don't know everything. I rely on mentors and that all the time. So be active and get involved, and don't be afraid to make mistakes with questions. Nobody is judging at all. So anyway, I did decide to pursue implants, and I initially started off with just prosthetics and restorative. And it was years before I got into surgery, but I was running into the same problems as a lot of people, where we were referring out and getting things back that we couldn't restore, or getting things back that we were just lost on because we just didn't have enough education. So I got involved a little heavier and moved my career along, and that's what I'm going to talk to you guys about here. So one of the other things I will mention, and this is something I just forgot to mention, it's important, but I'm very involved in flight. I am a pilot, and I went through my pilot's license training at the same time I went through MaxiCourse in Vancouver, which was a little bit to bite off, but it all worked out in the end. But one of the things that I found when I was going through my flight training was how incredibly disciplined and organized flight training is all over the world. There's protocols and there's testing, and everything is kind of standardized. Unlike dentistry, where we can go to lots of different courses, get lots of different opinions, lots of different ways to do things, and then lots of arguments about who's right and who's wrong. We all find that frustrating, and that's not going to change. But what I found with flight training is it really focused me in on the education side of things and how things should be more standardized. And that's a hard thing to do in dentistry, but we're gonna try, because once you start going through a protocol or process, and I was mentioning this earlier, you get so used to doing the same thing over and over, it just becomes second nature. It becomes easy, and what seems easy to some people is really complex to others. So I will use some flight analogies here, flight training analogies, just to get my point across. So bear with me. Oops, hang on there. Okay, I'm just trying to get this to work. To the next slide. Oh, there we go. So, learning to fly. Learning to fly in the sense of me getting my pilot's license and learning to fly in the sense of implant dentistry are very similar. You kind of got to start with your feet on the ground, your head based in reality, and you're going to need a little help from some friends to give you some support in the beginning. You know, a lot of us, and especially through my experience in MaxiCourse, a lot of us in dentistry are a certain type of personality. We're eager, we're excited to jump in and get going, and we often take on things, big things, a lot sooner than we should. We have very high expectations for ourselves in a lot of cases. Where, you know, some people refer to type A personalities. I think in dentistry there's a lot of triple A's and double A's. But yeah, I mean, we tend to set our sights high. And it was no different when it came to flying. I kind of thought, well, hey, you know, I'm going to get my pilot's license and jump into something like this and be zooming along. And that's just not reality, right? And it's no difference with implants. A lot of people will get into a basic implant course, a surgical course in a lot of cases, over a short period of time, whether it's a weekend or, you know, a couple of weeks, and they think they can just go out there and start flying jets, or placing, you know, all on fours or all on sixes or full mouth or whatever. It's just not safe, and eventually you're going to run into problems, and the problems are most dangerous when you really don't have a good background in what you're doing. So getting the background, you have to kind of start from the ground, work your way up. So in flight school, we've got ground school. And you know, you start with these small planes and you learn everything about your systems. You learn about the basics of how a plane works, how weather works, aerodynamics, navigation. You get all this basic stuff in, you know, which to me was really exciting because it's a new adventure, right? So again, you know, being a dentist and having the type of personality that we take on these big things, I was all excited for ground school, and my reference point was, of course, you know, Top Gun, and I thought, well, ground school is going to be so cool. I'm going to have so much fun. And yeah, it's not quite like that. It's more like a dental course, you know, sitting in a room, oftentimes half asleep, and trying to cram all this heavy information into your head. Of course, ground school for dentistry looks more like this. And I'm sure you guys are familiar with this scene if you've ever been to a lecture after lunch at a convention. I thought this was pretty funny. This was actually just it's too bad my camera didn't have a wide angle, because there was probably about 20 people with their heads down beside me there. So, but you guys can relate to this, I'm sure. So bottom line is, some of this information can be a bit dry. It's not as exciting as Top Gun ground school, but it's certainly a little bit more exciting than some of the debates that have been going on lately. So, you know, I will say that Bike Club does have a fun side. So when it comes to getting involved into implant dentistry, Denise, you had mentioned that sometimes, you know, you send these patients out, they go to the specialist, and you really don't know what's going on, what's happening there. And that's one way of dealing with implantology. Another way is getting involved to different degrees with the more or less, I don't like football that much, so quarterbacking, you know, the whole thing, directing the whole thing. And you can take that as far as you want. You can get involved as much as you want. Ground school is kind of where you make those decisions. So when I'm going to ground school, it's no different than when you're going to med school or dental school. There's lots of options when you get out. I mean, you can do orthodontics or periodontics or prosthodontics, but you really don't know until you get your basics in, right? What you're going to like and not like. Well, implantology is the same. There's lots of options as you go along, and you can get off at any floor on that elevator and just decide that that's where you're going to stay, and that's fine. There's nothing wrong with that. Not everybody has to do surgery, and not everybody has to restore implants. But I will tell you, with the number of implants that are now in our society, and more every day, there's not many offices that aren't going to see a patient with an implant in their mouth at least once a week now. And even if you didn't place that implant, you're going to have to deal with it to some degree, whether it's maintaining it, monitoring it, or referring it out if there's problems, or dealing with the problems yourself. So again, understanding what you're dealing with, you can't necessarily survive too long by just referring every single implant situation out, because patients will tend to move off to other clinics. And sorry, just one slide got stuck here. Okay, I got it. So ground school, what does it look like in terms of dentistry? Well, this is the slide I got stuck on because I was trying to remember. Well, one of the reasons that I think ground school or basic implant training is so important, whether you're doing surgery or not, or whether you're really involved in restorations or not, is this question here. And I've asked a few people this question, and it's an interesting one, because I know when I was thinking of this question, my mind directly goes somewhere. And if I ask either, of you here, when do you just think implants fail most often, or when do implant failures most often occur? Most people will think, you've got a couple of options. They're either going to fail in the surgical stage, or they're going to fail in the prosthetic stage, right? Or, if you've been in dentistry long enough, you'll realize that most failures occur on the Friday before a long weekend stage. So that's generally what happens. But seriously, if you do get that question, when do you think implant failures occur most often? People are going to bounce between surgery and prosthetic, but I think after many years of looking at this and reading different things and going to different lectures, I'm starting to very much realize that failures most often occur right here. And that's welcome to my office, basically, your new patient exam. And the reason they fail here is because this is where a lot of information is missed. So you may go into a surgical phase, get an implant in there, and it fails, and you just can't figure out why it failed. And it may have been because something was missed during this stage. You may have a successful surgical implant, and then you restore it, and it fails 6 months, a year later, and everybody's trying to blame each other on why it failed. It may have been the introductory. And again, I've been through a lot of training, and I've been through many exams and tests and things. And I have to say, it wasn't until really recently that I started going back and reevaluating how I treat new patient exams and when it comes to implants, because I really lose sleep over failed implants. And even though I'm never going to come to a realization of what caused it, my mind always kind of went to, did I do something wrong in surgery? Did I do something wrong in prosthetics? But it never really went back to, what did I miss maybe? And maybe it's nothing. Maybe it's just biology, right? And that happens. We can't blame ourselves for everything, but it's not about blame here. It's about learning. And if we can learn how to prevent failures, then hey, it's good for our sleep patterns, right? So part of what we get into in Bite Club is how to do a really detailed analysis of what you're getting into when it comes to implants, so that you're not setting patients up for failure, basically. And having that basic knowledge is what's going to help you. So if you decide that you want to get into implantology, what does a career in implantology look like? Well, like I said, it can look like a lot of different things. But basically, it starts at the ground level, and it starts with a more simple system. Now, if you're not a pilot or you're not an implantologist, you'll have the same reaction to looking at something like this. If you've never been in a plane or flown a plane before, this looks pretty complex, and you kind of think, well, I wouldn't know the first thing to do when I sit in that cockpit. I don't know what the dials mean or anything, right? But you do this enough, which is what flight training does repetitively, this all becomes second nature. You can close your eyes and do this. Whoops, okay. See if I can go back there. Sorry about that. Too many clicks. Okay, so the analogy here in implant dentistry is a case that I like to show here where, you can look at a case like this. So this is a 3D scan, obvious issues with that tooth with the red arrows because of the big black mass there. And this tooth is going to come out. Now, it's a single tooth. It's easy to access. It's in the front of the mouth. So it looks like it could be a relatively simple system, but excuse me, but sometimes things that look simple, if you don't have the basic knowledge, can be a lot more complex than you realize. This, again, you can get lots of training on this and it can look simple after a while. The things that you may be missing are weather, other traffic out there. You could be missing all kinds of things that you didn't get trained. You got training on how to work the system, or you got training on how to place a single implant, but you may be missing a whole lot more information that you've just never even been introduced to. But as you go along, you're going to start realizing that as you increase your skill set in any sort of education program, you're going to start to realize what you don't know. And that's the key, because it's what you don't know that can get you into trouble. So like I said, you can jump off the elevator at any time. You could stay with that kind of scenario, with that kind of plane or that kind of implant level, but you can also take it to a much higher level. Now, this would scare the heck out of any pilot who hasn't had training on something like this, right? But again, people fly this every day, and you may not be the kind of person who ever wants to fly something like that. You may just enjoy flying your little plane. And you may not be the kind of person that wants to deal with something like this as far as implants. But for some people, this is well, I don't know if it's every day. I don't know if anybody would want that every day, but for some people, this is the norm. This is the norm. Somebody has to fly this plane and somebody has to treat this patient. And you're not going to just jump into this. You're going to work your way up. So this is not for everybody, like I said, but you can see where implant careers can take you a long way. Now, one of the things that happens in both aeronautics and in dentistry, medicine, is some of those complexities that we're facing. You get somebody who's technologically advanced that comes along and says, you know what, doc, or you know what, captain, I'm going to make this so much easier on you. I'm going to introduce some technology that's going to take a lot of the thought process out of it. So things are automated. You don't have to worry too much because the plane thinks for itself, or you don't have to worry about surgery because the GPS and the robotics do it for you. Well, that's great. I'm a tech geek. I love technology, but a lot of this technology that's coming out, it's wonderful stuff. But again, if you jump into this without a background, basic knowledge, and you run into problems, then you're in trouble, right? No different in implant dentistry. This may make life a lot easier for people that are doing lots of implants, but if you get into one of these sales pitches where they tell you that you could be placing implants no problem at all with all this because it takes all the guesswork out of it, yeah, you might place 9, 10, 15, 20 great implants. But as soon as something goes wrong and you have no idea how to deal with it because the computer didn't tell you, that's the problem. And basically, accidents happen both in planes and in dentistry when you run out of experience, not when you run out of technology. And I hope that makes sense, because we're getting inundated with technology these days. So I don't think mistakes are a bad thing, by the way. I think mistakes are fantastic. And it took me a long time, because we've all got egos. Regardless of what Andrew says, I do have an ego. And we don't like those egos being bruised. So we're often afraid to ask questions because we think our colleagues might think we're stupid, or we don't know what we're doing or whatever. But the bottom line is, when we go to these conventions and courses and the lecturer asks the question and everybody's dead silent, everybody's got that same thought, right? But you know, the people that learn the most are the people that blurt something out. And if you're wrong, there is a little bit of embarrassment in that. That's human nature, but that's going to teach you more than if you sit there silently and just, you know, listen to the answer. Embarrassing yourself a little bit is actually not a bad learning tool, right? So I'm starting to, it's a tough one to get over, I admit, but I'm starting to ask questions, not worrying about whether it looks like I just don't know what I'm doing if I'm in courses, because I definitely find that that helps learn, or it helps you learn faster. So learning from our own mistakes is wonderful. Learning from other people's mistakes is even more wonderful, right? So that's the nice thing about all these mentors that are involved in these courses is we've made a ton of mistakes, and we actually pass that on as knowledge of what not to do. And Andrew can back me up on this, and I know we talked about this at the other lecture, that in MaxiCourse, one of the mentors comes in and basically does the whole afternoon of failures and disasters. And it's one of the more popular seminars because people just love to see. You learn so much from that, right?
Definitely.
Andrew's nodding. Yeah. Yeah, so make mistakes. It's all good. All right, so where are you going to make these mistakes? Or where are you going to learn from people that have made them before you? Well, I'll explain a little bit about the education programs that Bike Club is involved with. The main organization that we're working with is the Canadian Dental Implant Center, which is Dr. Liang's organization, which Andrew is the education coordinator director for. And you'll notice the red umbrella here, and the umbrella is more or less the Canadian Dental Implant Training Center. And under that umbrella, as Andrew had mentioned, I think Denise, you got that, and Muriel, you know all about this, but there's the MaxiCourse. And the MaxiCourse is the big one. It's the American Academy of Implant Dentistry course that's held. There's a bunch of them all over the world. Vancouver's got one of the top courses in the world because it's very hands-on. I was very lucky to go through at a time that we didn't have a lot of students or in the class, so I was able to do a lot more surgeries than I think some people get to do these days. I was trying to do more surgeries than I think they liked because I was taking too many time slots. I don't know. But again, you know, you learn from doing, right? And the Vancouver MaxiCourse is fantastic for that. But when I went through the MaxiCourse, as Andrew had pointed out, my colleagues and I that were going through were completely overwhelmed. And this is, you know, coming from somebody with a fair amount of surgery background. And there's so much information that we kind of were getting to the end of the course, starting to realize that maybe we're out of our league, you know, maybe we should think twice about what we're doing when it comes to implants. But it's just trying to process that level of information. But one of the things that we have in MaxiCourse towards the end is we're prepping for the credentialing through the AID. And the people that I was in the course with just said, you know, I don't think I'm ready for that test. I just feel completely overwhelmed with the information. So through that, we started talking about adding basically a pre-course to MaxiCourse to get people up to speed so MaxiCourse wasn't such a hit when they went in. And that's where we developed Bike Club. Now, as we developed Bike Club as an intro, we started to realize, hey, wait a second, you know, a lot of what is missing in the implant world is a prosthetic restorative side, because not everybody wants to do surgery. So not everybody's going to go into MaxiCourse after taking Bike Club, but some people are. So we need to gear Bike Club to be kind of inclusive that way. So it's geared towards restorative and pros, but it has we dive into surgery to some degree, just so you're aware of what's going on. So as Denise had mentioned, you know, sending patients out to specialists and not really knowing what's going on. If you understand the surgery to some degree, then you're going to know what's going on. You can actually guide things much better with a specialist. You tell the specialist what you want. So that's kind of where Bike Club is developed from. I'll get more into it. If you are in MaxiCourse and you graduate through, then you want to continue on learning more and more, like getting up to the level of that, huge jet with all the dials. Then you start heading into the study club, which is Continuum, and that's more or less where we get together after MaxiCourse as a group and learn from each other doing more complex cases. So here's Bill, and he is my mentor and mentor to many. He's very involved. He's been involved in implant dentistry from, dental school basically, and that was a while ago. And over the years, he's done it all. I mean, he's got fellowships in so many different academies, and he's involved in so much education. And many of the fellowships are through implant dentistry and cosmetic dentistry and general dentistry and that sort of thing. And the thing I like about the group that's involved is they're multi-dimensional. Bill is not just a stick in a suit. He's also an athlete, triathlete, and he's done Ironman a few times. I think he's done it 468 times. I don't know. No, he's done it a few times. But yeah, Bill's quite active, and we get together on bikes and go for runs. And I'm not much of a golfer, so that's where my learning is: running and cycling, not golfing. So that's Bill. And then, as I said, there's the courses that fall under Bill's Dental Implant Training Center, MaxiCourse, and Continuum. Just a little bit of background there on MaxiCourse. Andrew already mentioned that it's a 300-hour course. It's a big one. 300 hours is kind of an underestimate. It's when you're, 300 hours of lectures and didactic and implants, but you're also reading tons. So that 300 hours jumps up real quick. I don't think you come out of a year of Maxi without doing 400 or 500 hours of learning. It's a pretty comprehensive surgical program, and like I said, it's a big one. So sometimes you come out of there feeling like you might want to take it again, which I've done because now I'm working with MaxiCourse. I get to redo it, and I swear to God, I've learned something new every single lecture, every single year. It's the MaxiCourse is mentored by ABOI diplomates. ABOI is the credentialing board for the Academy of Dentistry, the American Academy of Implant Dentistry. So a diplomate's the highest level you can get in terms of credentials for colleagues to recognize you as you're the top. So the surgical mentors are all diplomates. And the guest speakers that come in are internationally renowned speakers in all sorts of fields: anatomy, pharmacology, periodontists, and prosthodontists. So it's a full-on course, and it's really comprehensive. And like in flight training, you don't want one instructor telling you everything because you're just going to learn all the bad habits. You have multiple instructors, and in implantology, it's always good to get lots of different opinions, lots of different points of view. Continuum, as I said, is the advanced course after, where you just start doing more advanced cases, working together with colleagues in surgical environment. Bike Club is ours. So Bike Club is either pre-MaxiCourse if you want to get into MaxiCourse. It really does give you a nice ground school, getting into flight school there. Or if you decide that you're just not into the surgery, it's a standalone. I mean, it's a good course for anybody that's confused about what they're going to do with implants. It's evidence-based. This is not stuff that I make up. It's all out of the research, so we try to stick to that. We'll talk about opinions and we'll talk about anecdotal, but really we try to stick to the consensus reports and what's working, right? So I'm running this course with Andrew, and I graduated back in, oh my God, does that say 93? Yeah, so graduated back in 93, still going strong. I first got out into education by starting a laser group in Vancouver. It was the first one in Canada, and we had a good 7-year run before we ran out of things to laser chat about. And then I moved on into some more advanced cosmetic training through LVI and another organization here. So anyway, that's a bit about me and me scrubbing up for a surgery at MaxiCourse. All right, and I'm also like to be on the bike and that, so get out there a fair bit. Yeah. All right, so graduation. The reason I show you in this picture is because when you graduate from flight school, they sit you on a picnic table and they have a camera on you and they interview you because it's all exciting. You're about to go off on your new adventure and you just graduated, so you're all, you know, confident and feeling good about yourself. And they all sneak up behind you with buckets of cold water. And you can see I wasn't really expecting that. And like, why would you do that? Why would you do that? But why they do that is to actually they get a point across. I mean, it's a graduation ceremony, but I'm sure MaxiCourse and Bike Club won't do this to you. Our graduation's much nicer. But the idea here is to always be aware, even when you think you know it all, you're ready to go, you got your diploma or you got your flight certificate or you got your, you know, implant certificate. If you're not paying attention to your surroundings, you can still get caught out. So, all right, so where did this all start? Okay, so the American Academy of Implant Dentistry is kind of where this is all based out of, because this is the organization we belong to for advancing implant knowledge and the research that comes out that helps us kind of guide in our treatment planning and that. And it's interesting because the Academy, when I thought about joining the Academy, and a lot of people I've talked to have mentioned the same thought, is that, and I don't know if Denise or Marielle, you can talk to this, but you kind of get the sense that everybody's doing surgery, right? Like anybody who belongs to the Academy of Implant Dentistry is obviously a surgeon. Every dentist down the street is doing surgery, like everybody's doing it. And we live in our offices and we live in our little islands, and we sometimes don't get a good picture of what's going on out there. So we've got misconceptions. Sometimes we feel like we're falling behind, and this is something that Andrew points out to me all the time, is I always feel like everybody's doing the same thing. So is there anything to teach? But then I find out that not everybody's doing the same thing. In fact, if you look at the membership in the Academy, which is a good representation of the general dental, population, this is 2016, but I'm told that the percentages are still the same. It's just a year and the numbers have changed. If you look at what's going on out there, and these are Academy members, so people that are really into implantology, right? 83% of the people involved in this Academy are GPs. They're not specialists. There are a few periodontists and oral surgeons and pros, but huge percentage of GPs. So you think, oh yeah, okay, doctor knew it, big deal, all these GPs are doing surgery, right? Well, they're not. And this surprised me even when I first saw this, because again, I just assumed everybody that I met at a convention with AID was a surgeon. And it turns out that basically 3/4 of the population of dentists involved in this are restoring only. They're not doing the surgery. Again, it's these misconceptions. I'm surrounded by, in MaxiCourse, surgeons. That's all we talk about. That's, what we're dealing with all the time. So I just assume, I can go to the grocery store and the person checking me out, I'm pretty sure is a surgeon. Everybody's a surgeon. So the reason that I bring this up is because I want people to realize that if you decide not to do surgery, that's fine. That's what most people decide. It's not a big deal. But you still have to get involved somehow in the implant side of things, because it's going to be coming to your office in droves. So taking a look at why an education in implant dentistry from a restorative side of things is important, I'll give you a few slides as examples. And these are things that we see in our office all the time. So as a restorative dentist, you get, say, a picture like this coming back, and you go, okay, well, the surgeon did a pretty good job. Everything looks pretty good there. I'm going to take those thingies off. I'm not sure what they're called. I'm not sure what type of implants these are. Where do I get my parts? Does this root canal have anything to do with anything? I don't know. I'm just going to restore these with some crowns. And you go and you get ready to restore with the crowns. Other times you'll get patients that already have implants in their mouth, and they present as new patients, and you kind of take, you take some radiographs, and nobody's said anything to them, but you have to deal with this now in terms of talking to your patient. Do you just go, well, I don't know what the heck's going on here, and send them out? Or do you have a discussion with your patient and say, well, I do know what's going on here, and this is what I suggest? That's what Bite Club is hopefully going to help with, is learning how to talk to your patients. You don't have to surgically correct this yourself. You may if you want. Depends on how far you want to take that flight training. But if you decide that this is not your thing, at least be able to talk to your patients about expectations, next step, that sort of thing. Or you get a patient that comes to you like this and says, oh, I was referred to you not because you do implants, but I was referred to you because I hear you're really good at periodontics. I heard you've got a laser and you can treat this with a laser. So, even if you're not doing the surgery, the patients come to you thinking that you can do something about this. So all of these cases are things that may just show up in your office, even though you didn't do any surgery. So what I can tell you about all these cases is every single one of them is a failure. And like I said early on, you start racking your brain as to why they're failures. Now, this is a failure. The center one's a failure because of a number of different reasons that I won't get into, but it has to be dealt with. So you've got to either deal with this or refer it out, right? But again, talking to your patient. This one, you got your patient saying, well, there's no pain. The tooth isn't moving. Do I have to remove it? What sort of advice are you going to give a patient like this if you don't have a background information on what's going on? The first case here looks pretty good. And you think, well, why would that fail? But unfortunately, again, this is one of these cases where everything looks good, you restore it, a year later, the implants come out. And then you start going through what went wrong. If you've got enough information, you might be able to figure that out. If you don't, then you're just going to have to live with the fact that sometimes they don't work. So now this patient here, even if you have a little bit of knowledge in implant, you probably have heard that cement is not necessarily a good thing being shoved into the socket. And you can't really necessarily see it on this image. Maybe you can on your screen, but there is a bit of image cement showing up on the x-ray here. But this was a screw retained crown, so we could unscrew it and go, oh, well, geez, that looks like that might have been the cause. Does that help the patient? Not necessarily, because there's so much bone missing that this is pretty much unlikely to be restored. But there are some techniques you can use, and if you've got the knowledge, you can possibly grow some bone back on this, and this could stay in the patient's mouth functioning if it's not infected for many years. Just depends on your knowledge. If you don't have that knowledge and you send it off to have it removed, a surgeon will happily remove it. But what else are you going to do here? So in some cases, things that look like they're in real trouble may not be, and other times they are. So you just have to have that basic knowledge, which I hope we can impart through Bite Club. So that's kind of some of the things that we face in Bite Club, not to mention hundreds of different components, which confuse the heck out of most people. In fact, when we actually used to get together in the before time, we would sit down on our very first meeting, and I had a little ice cube tray full of all these different parts. And I even tried to make it easier by having an answer sheet with the actual names of the parts on it, but just kind of mixed up a little bit. And hopefully people could, match the names. It's amazing after several years of running Bite Club how 90% of the people still got those all wrong. But not amazing in a bad way, amazing in that it kept telling us or letting us know that what we were doing is right. Because if people don't know the names of these components and they can't talk to their labs or their specialists or even their patients about this stuff, then we're on the right track putting together a course for this. So again, so some of those mistakes and failures are good learning experiences, and they've taught us that, yeah, this is what we need to focus on in this course. There's tons of surgical courses out there. Brochures show up at your office all the time for surgical courses, whether they're weekend courses or Some sales reps will even come in and say, I'll sit down beside you and show you how to do your first implant, which is great if you're learning to put a screw in a wall, but if you're trying to put an implant into a living tissue, it's not so great. You may nail that first one, but if you run into problems, then, you know, as we said, run out of experience, that's when the issues hit. So, Bite Club. We decided to put this together, as I said, as a pre-Maxi or a standalone restorative. And in doing so, we decided to kind of do a mini version of a prosthetic implant course and a mini version of a surgical course and combine them. And then we split it into 7 sections. And this is one of the brochures that we have out talking about the different sessions. And we have some fun names for them because, hey, we're fun people. You know, this brochure, but there's a bit of information on there. And if you don't, I'm sure Andrew's sending stuff out. But let me break it down a little bit just so you understand and why I think that this program is good for both the restorative pros dentist. It's good for the pre-surgical implant dentist. And it's actually good for CDAs and hygienists too. And even reception, I think, because what we go through, if the whole team understands what each of us is doing, it just makes for a much smoother day, especially when it comes to implants, when there's so many components, so many different names. So of course, our first session was based on that, implantinclature or nomenclature for implants. A bit of a mouthful for sure, but we realized, like I said, from those little ice cube tray exams, that there's a lot of confusion. And if there's that much confusion when it comes to parts, how the heck do you order parts? How do you talk to your lab about what you want? How do you know what to, get in terms of, if you're sending to a specialist, which systems to use, which ones that you're going to be able to restore with more success? So that's implantinclature. The second one, don't get screwed, is more to do with that slide that I brought up about when do you think implants fail? And I said it's probably to do with the introduction of a new patient. Of course, when the new patient comes in, they're introduced to the receptionist, the CDA, the hygienist, everybody's involved. And questions come up, and there's certain things you have to screen for. And if people know what they're looking for as a team, you're going to be much more successful in putting together a treatment plan for patients that either want implants or are heading that direction because they're going to lose a tooth or many teeth. So don't get screwed, more or less about learning how to identify what's going on with your patient, medical, dentally, cosmetically, and we've only got 7 sessions, but we could probably just make a whole course just out of that. The third session builds off of that, and now we've got a bit of understanding of the language of implants and the parts. We got a little bit of better idea of how to diagnose and treatment plan. But in setting that up, we are going to start launching ourselves into an area that we may not be familiar with, which is 3D diagnostics, whether that's STL scanning or CBCT scanning. So session 3, we tend to get more into when to order these scans, what the scans are good for, whether a PA is good, a PAN's good, a CBCT is good, that sort of thing. I don't know what's going to go on this year. In the past, we've actually had a radiologist talk to us. We've had people from Orbit Imaging talk to us. So we can get other people involved, and Andrew will fill us in on that a bit. Then once we got that information, we're going to go into our first implants, and the best place to start is the posterior in the back. And the reason for that is because nobody can really see what we're doing. And in a sense, that's important, because if your first implants are going to be front and center on somebody with a huge smile and they're a model, an Instagram model or something, if you screw up, then that's not going to go over very well. But if you have a few threads showing, a little bit of metal on a 7, you're going to be okay. So starting with the posterior is where most people should start, whether it's restorative or the surgery. You can have a really nicely placed implant in the anterior. Surgically, it's a success, and then the restorative dentist comes along and things go south really quickly, and that can be debilitating aesthetically. So you got to be really careful with anteriors. So we save that for the 5th session. With that session, we start getting into the complexity of the anterior, some of the things to look out for in terms of risk profiles, cosmetic risk profiles. I did a lot of teaching with the California Center for Advanced Dentistry on Cosmetics, and I'll put that into the course so that we can analyze not just a single tooth, but the whole smile. As we get our implants in, then we have to start thinking about occlusion, which is one of the most confusing areas in dentistry and controversial. But it's important because if you think back to those 3 radiographs I showed you, and the first one that looked pretty good, that failed because of occlusion. So you can have a really good surgical result, really good restorative result, but the patient can still blast the heck out of your implants if you're not careful. And then the final session is we refer to as hands-on, hands-off. And it really comes down to how do you maintain these things? When should you touch them? When shouldn't you touch them? And there are protocols and algorithms for this that we'll get into that'll make life a lot easier. One of the things I see consulting with our College of Dental Surgeons with complaints often is restorative dentists will get cases where implants are failing, like that one I showed you with all the bone missing. And because they don't really know what to do, they don't really say anything and the patient's not got any pain. Problem is that can come back and bite you if you basically, I think it's observe neglect, right? You're just not giving the patient any options because you really don't know what's going on. So the last session we talk about implant, peri-implantitis, peri-mucositis. Yeah. All right, and that's pretty much it. I put the little Groot in there because this I was trying to find the video of you guys see this movie where they keep asking for something and he keeps bringing the wrong thing. It's like when we're asking for stuff in implants and our staff, our admin staff are bringing us the wrong stuff because they just haven't been taught any more than we have about all the names of the parts.